want to start by thanking everyone who made it out to this crucial event. And I want to share that this action today in front of Mark Carney's MP constituency office, which is right up here on the second floor. This rally is one of 12 actions at local MP offices across the country as part of a pan-Canadian day of action to save our public Medicare system.
Yeah.
Woo! We invited Mr. Carney to speak and to show his support for Medicare, but he declined our invitation. Regardless of that, we are here to let him know that we will not let them dismantle or permit the dismantling of our public health care system. The Ottawa Health Coalition and a growing network of public health care defenders are absolutely alarmed about the following two developments. One, Alberta Premier Danielle Smith's government passed a new law in December of 2025 that has ended universal public health care and brought in US-style two-tier privatized health care to the province of Alberta. Number two, Ontario's Premier, Doug Ford, his government is continuing to cut, to close, and to privatize our public hospitals and to expand the role of private for-profit businesses in our healthcare system. We call on both the governments of Alberta and Ontario to stop and to reverse these privatization policies and the destruction of public health care that they represent. However, recognizing that these governments have shown no willingness to reverse these dangerous policies on their own, we are here today to call directly on Mark Carney and the federal government of Canada to stand up to the provinces of Alberta and Ontario and to announce their decision to enforce the clear provisions and principles of the Canada Health Act in order to save our public health care system from this dire existential threat. We recall today the promises of Mark Carney and the Liberal Party of Canada that they made in their 2025 election platform. In that platform, released less than a year ago today, they stated as follows, quote, "In the United States, healthcare is a business. In Canada, it's a right."
Yeah.
Together, says the Liberal Party platform, we will stand up to defend the Canada Health Act and build a healthcare system that we can be proud of. It's time to return to the foundational values upon which our national healthcare was developed, free of charge, fair, universal, and accessible. It is absolutely clear that Bill 11 in Alberta fails these tests and these values. And yet, Prime Minister Carney and his Minister of Health, the singular political authority able to enforce this federal legislation of the Canada Health Act, so far they have remained entirely and shamefully silent. If Mr. Carney won't stand up in defense of our most fundamental social program and the values and caring that it represents, we are here to put him and his government on notice. We will not support any elected leader who fails to stand up for public health care and facilitates a US-style privatization of our system. Premier Smith's Bill 11 in Alberta has created the legal framework for privatizing health care, ending single-tier Medicare as a national product, and it enables doctors to charge patients directly for health care and to bill the public health system at the same time. Bill 11 creates a market for private for-profit health insurance companies. We're told that actually private health insurance companies helped to draft Bill 11 in Alberta. We know that doctors will choose which patients are charged and for what services. If patients can't pay, They have to find a doctor who won't charge. The bottom line, this legislation is the most comprehensive attack on public Medicare in the history of this program. Now, a word about what's been happening already, even before this in Ontario. As I said, Ontario Premier Doug Ford has launched in recent years unprecedented privatization of our public hospitals. He is now allowing private clinics to charge patients thousands of dollars for needed care, including cataract surgeries that cost over $10,000 charged to patients. He has supported private for-profit provision of long-term care, of blood services, of primary care, the public health system, and more. In the last 6 months alone, the Ford government has announced almost $300 million for 61 new private for-profit clinics, a number of which are large-scale facilities, essentially private hospitals. At the same time, most of Ontario's public hospitals have been pushed into deficit by underfunding. Just one example, here in Ottawa, our Bruyere health system recently announced 55 layoffs of crucial healthcare workers. And yet Ontario still funds its hospitals at the lowest rate of any province in the country. If we don't fight back, we will lose. If we lose, our province and our country will be fundamentally changed for the worse, and millions will suffer. We here today have gathered to demand that Mark Carney, MP for Nepean and Prime Minister of Canada, take the following 2 immediate steps. Number 1, publicly declare Bill 11 in Alberta to be a breach of the Canada Health Act and its fundamental principles. And number 2, announce that the enforcement of the Canada Health Act with maximum measures will be initiated as soon as practically possible, including the suspension of federal health care transfer payments to the province of Alberta until such time as there is full restoration of Alberta's compliance with the Canada Health Act. Today's action is really the beginning of this campaign. Ottawa Health Coalition has plans for a major town hall meeting on April 8th. There will be another mass mobilization of our supporters at the Human Rights Monument downtown on April 25th. For any of you who aren't already with us, join our Facebook page, get in touch with us. Nancy and others are here. We can take your email address. We are going to build a social movement in defense of our public health care system that will be unstoppable. Thank you very much.